Hi everyone, this is a recorded version of the presentation, which I gave a longer version of at the briefing event around the wellbeing pathway that we kicked off this week. Um, there was well over 150 who had been invited, who were people I've met through networks, through meetings, through our own events, who have all expressed an interest in one way or another to be involved within the wellbeing pathway development. And this presentation and the files alongside it that I've included are designed to sort of tell you where we're up to, what the wellbeing pathway is kind of about, and what the next steps are that we're proposing. So I'm hoping to whip through this in about 10-12 minutes. So if you're watching this, I'll also refer to some links at the end that you can use by clicking on the PDF of the slides. You can find that within that. You can follow along as I'm doing it. And also you'll find a couple of another attachment with your email, which is an evidence cheat sheet, which has got sort of links to sort of the examples of the types of evidence we're referring to when I present that in the document as well. And so this is just to say, obviously, if you're not a member of the Wellbeing Network already or haven't heard about it, you can join up today by going to teeswellbeingnetwork.org or scan this QR code on the right-hand side, and that will take you straight through to signing up to the Wellbeing Network. And it tells you here quite a lot about kind of why you should join the network, the types of reasons why people get involved, not least of which is getting to hear about developments like this to try and create much more connectedness and collaboration across our system where when we join up, obviously we can achieve so much more to the benefit of people living across the South Tees area. The Wellbeing Network, of course, is, if you're not familiar as well, is a system-facing network to people who work or volunteer, have a role to play in supporting others with their own well-being across the South Tees area. And well-being is defined on our website. If you go to what is well-being under Explore, you can find out how we define it and how we split it into the 15 different areas that we do in terms of topic. So let me push on. That's who I am. I'm Richie Andrew. I work in the mental health team within Public Health South Tees. The Wellbeing Pathway was something which was the idea was developed in parallel to the Wellbeing Network. The belief being that the network needed to be established and get to a reasonable membership level. We're nearly at 1,000 to be able to do a proper cross-system piece of work with the Wellbeing Pathway. So it's very much in development. It's very much a long-term development. And you'll see and hear more about this as we go through. What have I got covered over the next 10 minutes? So I'm going to talk about the pathway, the idea for the commission workshops, the actual commission workshops we've obviously commissioned, but what the nature of those will look like, the steering group that will decide about how and when those workshops should happen, support the recruitment to those workshops to make sure we get a good split across the system. There was a space in the presentation for questions and discussion, and I'm going to be sharing some information. You'll have some information shared with this about some of the content of that discussion. Within the main workshop, we started to do a SWOT analysis, and you may wish to email me directly about kind of strengths, weaknesses, opportunities and threats, what you think from the model. That'll be really helpful just to give us an insight into what other people's thoughts are at this early stage. And then we also had another whiteboarding section about to do with the steering group and its values as well. I'm not going to go into detail in these areas. I'm just going to stick to these 4 areas mostly, and then the last section about signing up to the stakeholders group and the steering group as part of the process to make this wellbeing pathway happen. So let me be really clear. I'm going to show you the basic model for such a pathway just to illustrate in a visual way how it wraps around an individual and the sort of benefits to different aspects of the system. And one of the very simple things we've done is to keep it basic in terms of a model. That last thing I'm here to do is dictate what this should look like at detail. What I am here to do is facilitate a process whereby the nuance and the detail can perhaps be teased out in terms of a quality development at scale for the pathway. So the aim for the pathway is simple. It's to create a compassionate, person-centered and trauma-informed wellbeing pathway that improves health outcomes, reduces health inequalities, supports staff wellbeing, enhances community resilience, and makes healthcare more sustainable and effective across the South Tees area. No small challenge. And it actually, as I said, it started with this briefing in 2019 about using an asset-based community development approach for the 5 ways to well-being. And the development has come from further reading, further understanding of the evidence, and then listening and researching ever since locally. So sometimes the best way to describe it when we talk about to create this pathway, it's like, well, what do we mean? So here's the basic model I've put together. I worked originally on the network and the pathway with Sharon Chappell, who's originally made the suggestion of a pathway to hook these things together when I was highlighting the issue on so many different pathways that we see, whether it's internally within the system, whether it's from the public to access services. There was always usually a section. If you take an example of like a cancer kind of pathway, there was usually a section within any pathway that would say, other community supports, for that person's well-being needs, or you might have a mental health step-down care pathway that talks about, like as a nice guideline that talks about not discharging someone until like a care plan, which includes other wellbeing supports, has been included. And it's about that and a whole lot more that really kicked off this conversation. So what you do is start at the bottom. What I'd like to do is start at the bottom section here. So imagine an individual. This is a universal offer. Anyone living within the South Tees area in this proposal would be able to access some sort of a self-led wellbeing process, which would help them to understand what their individual needs are. Now, that's one part of the person-centered element of it. If it's done in a trauma-informed way, then it's done in an inclusive way. It's done in a way which takes account of all the experiences of that person leading up to that point, and the actual individual needs of that person in terms of anything that could have been affected by trauma, and ultimately keeping them safe throughout a process. Its values of being person-centered also and trauma-informed are also accompanied by self-led empowerment. There is absolutely so much more that people can do to improve their health and well-being if they're enabled to and are empowered to. I think I read is that if we are doing things for people that they can do for themselves, then we're disempowering them basically. But there may be that there's reasons why people can't do things and they may need support. In which case, when someone was going through this process of understanding their need, whether it's a written assessment at a service or whatever it might be, there's a variety of options that meet the needs of that person. Whether it's, I don't like using digital, so it needs to be done as a paper-based or face-to-face with support from someone else, or they're really comfortable with that and actually they can navigate the way through. What they need help with is to prioritize and decide what it is they want to tackle first. And for a lot of in some cases, it might be that people need enhanced support, perhaps whether it's one-to-one or a little bit of advocacy that could range from social prescribers, care navigators, key workers, mental health coaches, peer supporters, all these types of role that have seen a massive growth in the South Tees area as something that could potentially be structured to clip on to a whole variety of assessments that individually suit people and allow them to go what their needs are. Now, in terms of what their needs are, what can they be? Well, it could be they're experiencing symptoms. It could be physical or mental health. And the outcome of this wellbeing pathway, by the way, is absolutely to reduce the demand, particularly for mental health, because so much mental health issues that arrive within the system in the medical model turn out to be very much rooted in well-being needs, whether it's financial support, employment support, relationship support, housing support, you name it. So what we're really trying to do here is flip the pressure from the system, where people are inappropriately referred to often, and actually move that effort and that energy back into a sort of well-being marketplace of support that's available that might actually, for a lot of people, help them avoid this unnecessary step. However, these two areas, when you look on the side here, you'll see managing symptoms on one side, generally handled by social care, primary or secondary health care. And then addressing the causes on the left-hand side also have massive overlap with social care, but also our voluntary sector, even our private sector, and a whole range of other supports, from walking groups through to our local gyms, through to nature groups, any types of volunteering opportunities, you name it. There's just huge amounts of things that people can do, which they find works for them, of course. People from this process of need might then find that they're getting support from here, from the primary and secondary care, and from the wellbeing marketplace. Now, what is a wellbeing marketplace? Well, if you look at your local directories in terms of what support's available, what's on, what entertainment, what sports activities, what sports clubs, what topic of interest, whether it's a Lego group or whether it's a support group for men, or whether it's a men's shed, or whether it's a women's support group, or it could just be like a women's social group, you name it. It's everything, all different sizes, also including housing support, all those big aspects of support that we offer people that are like major services, but all the way through to like small activities that just helps people to find meaning and purpose within their life and to be able to move forward with that. So that's what the wellbeing marketplace. It's basically anything that covers any of our 15 areas of wellbeing, which people can navigate themselves to. It might be there's aspects that people have to be referred into, which might split this wellbeing marketplace into, you can access this, which isn't a clinical intervention, but you can access this, but there's certain criteria you've got to get to get through this. Another aspect of this could simply be just activities that people can call up, turn up, pay for, not pay for, funded, and get access to. It's going to help them with their own development, but it's personalized. Their choices are personalized by their need. So at the moment we have directories, which we have a lot of them, offering all of them offer some really good services, or some good features, but they don't all offer the same. Perhaps one or even two different types of directories rather than the several we have could be one of the solutions to look at. We have an option here for a lot of people to completely avoid this primary and secondary sort of medicalized care if that's not what they need. Depending on how we do this assessment here and how people interact between these two spaces, it could be we end up with a load of really useful data that helps us to understand where the needs are within different areas of our Southeast geographic space. So does it give you intelligence that actually helps you plan for the future as well if it's designed in a certain way? Lots of different things to consider. But ultimately, you've got people can be referred from one clinical pathway across to here and work in parallel. People could be coming out the top of secondary care services where they've been hospitalised for mental health, and then when they're having the care plan put together in the community, they can have this wellbeing marketplace to tap into to help them plan that as well. And you could be people who are neither engaged in any of these processes, but are actually at a point of change where they're identified they want to, if you're promoting this to them, it'd be a case of like looking at change, looking to improve your lot. This is kind of where you can start, in terms of finding out what support's available for you locally. That's the idea. So the evidence groups that fall that actually support the pathway development: improve patient and person wellbeing outcomes, reduction in health and social inequalities evidence points heavily towards this. Cost effectiveness, systemic efficiency because of where people end up, because of the problems with the navigation and the lack of a person-centered approach towards it in a universal offer. Better staff wellbeing retention. The evidence is clear when it comes to investing in trauma-informed and person-centered services. Plenty of evidence in the NHS that has a huge impact on outcomes for patients in terms of the support and compassion that's part of the system, and that gives better outcomes for staff wellbeing retention in terms of pressures, in terms of how people feel about the impact of the job they're doing, and so on. Huge numbers of community and enhanced social benefits in terms of the community side of the evidence base. So not just in the system, but actually what does it look like in terms of the benefits to community groups and developments within communities and the people that access those activities to give them meaning and purpose. And then we've got loads of different successful regional models of wellbeing support to point at and look at the development of this. So as we get into different phases of the development, there's a huge amount of different evidence base we can look at, and I'm tapped into that, and I can get support to kind of bring that information forward. I'm also including an evidence cheat sheet with this email, so you can see more details about that, some examples of what that might look like. So the why, there's loads. This is not an exhaustive list of why, but I've mentioned some of these things already, but ultimately some of the current systems of navigation are replicated, whether it's kind of this kind of no wrong door thing. Some people might end up at the same door or end up in a loop. It might be that people's own individual needs haven't been assessed and not trauma informed in terms of like what's happened to them, what matters to you, and asking the question of what made a difference to you after each stage. We need to look at pathway that prioritizes understanding over assessment. So actually, not looking at just kind of the symptoms and the immediate problems, but understanding how that person arrived there and getting to that root cause to try and help them to be more empowered and develop into a space where they can actually take more control of their own lives. And there's an evidence of a lack of acknowledgement of empowerment and people's capacity for change, which I'm a great believer in. I think most people believe themselves to be less capable than they are at any level, and I think that's kind of something that the wellbeing pathway can really help with. Yes, talked about this. So yes, absolutely changes the focus to individual needs being addressed by the system rather than the system like trying to fill generic gaps. It's got in sort of population needs. It actually allows a sort of dynamic system where people's individual needs can be seen by themselves and understood by themselves, and then they can see what's available out there to navigate to as well. Of course, there's threats to and kind of and sort of weaknesses to a system like that potentially need to be considered in terms of like kind of where do you allocate resources to and when to make sure that the services are going to be there. But that is where the universal pathway can provide lots of useful sort of sets of large data that can be used across the system to help for planning and help to understand where the need is, perhaps. So on these commission workshops, we have looked. I've been working with Alan Johnson, who's from Change Working, who has supported other change programs locally in the development of the systems around that. He works to a system called Disney Imagineering, which is based around the theory of change model. So what you look at is taking groups of people through different stages, which sort of includes looking at different filters as a group of people at a time. So you really what we're saying is there'll be a couple of large scale workshops where people will be taken through a process of dreamer, planner, and critic, and on a repeated focusing on one of those areas where you can, dreamer is about blue sky thinking, it's about unlimited. If there's no barriers in the way, what would it look like? The planner can be realistic in terms of kind of what's available out there at the moment, the phases it might happen, what if there's any costs associated with it and so on. And the critic the critic role would obviously look at it from the point of view of kind of what, why it wouldn't work. But if you overlap all these things, you never get anything done. When you start to separate these sort of hats out, if you like, that's when you can get to a point where you can start to imagine what the process to get there might look like. So what we've got proposed, Alan's been commissioned to engage with early adopters, which I'm going to talk about here, map the change path, and then look at how we can actually start the process at the first phase. So he's going to take us through to that first phase. So the proposal at the moment is to have two groups of pre-workshops. One will be lived experience, one will be organisational representation. There's going to be a sign-up option I'm going to share with you in a minute to get involved within that level. People in the pre-workshops are essentially about getting early adopters. So we absolutely want one of those groups to be lived experience from across the well-being topics that we have and need. And then organisation representation might be one person from each organisation to get a fair representation of also early adopters. And I keep saying this early adopters thing. What I mean is when we get to this second set of large scale workshops, these people can actually be already informed on kind of what it is we're trying to do and what the process might look like, have their own thoughts formed to try and help others and recognise the types of conversations that are going to happen. And then actually support facilitation of these larger scale workshops as well, one in Middlesbrough, one in Redcar. And so we're giving you an option to sign up to a steering group as well, but actually to sign up as an early adopter or just someone who would take part in the workshops when we get to that point on behalf of your organisation. And so two groups of pre-workshops, two sets of area-based large-scale hybrid workshops online and face-to-face. And then thirdly, later, a first phase, once we've had the outcome of this being we identify steps we need to go through to get to the point of having the pathway developed. And the first part of those steps would be what the first phase would be for the workshop. So pre-workshops, getting our early adopters can help facilitate the process of the second set of workshops, which is a big engagement process. And then those organizations who have something to be involved in terms of that first phase, whether it's looking at assessments, how we actually assess people, that kind of thing, or might be looking at the local directories, or might be looking at how we map and actually bring together the wellbeing marketplace locally. Whatever it ends up being is that first phase will be that first workshop that starts that process. Now, throughout all this process, I'm looking at a steering group with shared leadership. That's what I'm proposing, with data collated, reviewed, and managed by that steering group. So anyone that volunteers a steering group, there is a specific ask for that, which I'm going to come into in just a sec. So at this point of the workshop, we actually asked people to start to do a SWOT analysis. So asking about strengths, weaknesses, opportunities, and threats to such a pathway. And I am going to give you an opportunity to email us at, I'm going to put this in the, you'll see this in the email. Email us back at info@teeswellbeingnetwork.org or Richie_Andrew at middlesbrough.gov.uk. I'll put those emails in the email itself, and let me know if you've got any particular thoughts on what you're seeing and hearing, and these particular strengths of it, weaknesses, opportunities, or threats. Let me know. Drop me an email back and just share some thoughts back, and I can include that in that SWOT analysis that I'm going to issue a little bit later on when we get into the steering group. And so the steering group purpose is to produce a process by which a wellbeing pathway plan can be developed at scale. The membership of that steering group needs to be representative of the wellbeing 15 factors, which there's a link there you can click on. So what is the wellbeing 15 factors? Take a look at them. They're on our website. You can see those. If you think that we're missing anything from there which covers well-being, how the current evidence on well-being, then please let us know. We'll find a place to include that in. We think it's fairly comprehensive, though, given the range of work that's available to support people's well-being. People who are going to join or put themselves forward for the steering group need to be able to represent the organisation they're a member of. They need to probably represent at least one of the wellbeing factors, that's for sure, maybe more. They need to be able to commit time and possibly organisational resources to this development. So it's a case of considering what your organisation's place is within this development and what you might get out of it. And it is broad. There are, for example, you might be sitting within housing and it might be something where you think, we don't have much of an involvement in this, yet there's housing officers out there that consider themselves to be like social workers almost, with the amount of referrals and support that they end up giving to people. And of course social housing has a role within that development as well. So we're trying to make essentially the system much more easy to navigate for individuals and for people who support others, to make it easier for them to support them as well. So yes, so of course the steering group and the way we operate will be values led, and kind of will promote shared leadership. So again, there's some more information I've attached about the steering group and some thoughts about kind of what that should look like and what the sort of tasks that the steering group should be looking at. So if you are thinking about getting involved, it should be pretty clear about kind of what the commitment will be to it. Okay, so lastly, the what next, definitely in. If you're in and you want to stay in, you want to stay involved. If you're ready to sign up as an organisational representative or someone with lived experience to the steering group, and we do want representation from both, you can use the link below, or copy the link and paste it into your browser, and fill in the online form for that. That's going to close at the moment, my proposal. We'll see how that goes, but at the moment I'm giving people a deadline of Friday, December the 13th, a month and a couple of days, to decide to do that organisationally. Again, commitments can change, and it's about expressing an interest in that steering group. And there's questions in there about kind of what your expectations would be, what you feel like you can bring to the table in terms of resourcing and experience and kind of wisdom to that process, as well as what you think you'll get out of it as well, perhaps organisationally or personally. That'd be really helpful to know. If the steering group isn't for you, then what you're looking at is the what next in terms of non-steering group stakeholders. So you want to support it, you can see the benefit of getting involved, and perhaps you want to get involved in either the early adopter workshops as a bit more of a kind of facilitator, kind of earlier stage role as an organisation, or just want to take part in the workshops. Follow this link, or again copy this link and paste it into your browser, and this will take you through to a slightly different form, which is going to give you those options basically. So we'll take that and we'll keep it ready to a separate database where we can communicate with you about the options for whatever type of workshops you want to get involved in at this stage as well. Of course, the biggest challenge of all this is that it's very much a scaling process. We'll have to start small with something and start looking at areas and then scale up over time. It is a huge undertaking, and so it's probably going to take many months, if not years. I suspect years, if it really gets to where it has the potential to get to. And of course, it's only going to be through the support of others. Getting involved that will make it actually happen as well. So that's where shared leadership really comes in strongly, and where these early adopters, I think, are probably going to make a huge difference. Organisations who can demonstrate how this type of approach could work. Ultimately, what's it about? Improving outcomes earlier for people in terms of prevention of mental health and physical health problems that are avoidable or preventable, generally speaking, and actually making that system much easier to navigate. For me, in the mental health team, my motivation is, of course, to reduce the prevalence of mental illness, but really where mental health is defined by the clinical system to be like a set of symptoms that's then called depression or anxiety, whatever it might be. Actually, what has led that person to getting there? Because treating those symptoms with mental health, it's not the same as the medical model for physical health, and it's something which is a little bit there's a lot of evidence out there now which is pushing back against to sort of suggest that we've sort of got it wrong, that we sort of view mental distress more as an individual issue, blaming the people themselves and their brains rather than looking at it as something which is, an issue is to do with the wider societal issues or successive governments and big business and the way that the systems have been managed and the pressures that people live in. You might even say it's perfectly normal to experience what people do, given what they've been through. What to prevent them getting to that end point, we need to be working with them at an earlier stage and looking at what their journey has been to get there and what's happened to them and support that, basically. So that's what it's all about. If you agree and it's something you want to get involved in, you know what to do. You've got the links there, you can sign up. And at the very least, we'd hope you turn up as a stakeholder, click this link and copy this into your browser and get registered. And we can start to build this work. Thanks so much. Hope that's answered all your questions.